Hello, everybody. My name is Don Rubin. I'm part of the University of Georgia Center for Health and Risk Communication. And over the last 10 months or so, I've also had the honor of working with a consortium of grassroots organizations that have contracts for health insurance navigator programs in 4 states. My role in this consortium has been to help the navigators to think about ways that they can express the really very complex ideas that one needs to understand in order to be able to make informed decisions about health insurance. And some of those ideas are so complex, even for those of us who have enjoyed health insurance for many, many years. And you can imagine that for those who are getting access to health services and health insurance for the first time, those ideas are even more.
Hi, I'm Samantha from Oklahoma. I'm a healthcare navigator here, and I was astounded by the lack of information at the healthcare.gov call center. Whenever one of the navigators or anyone from the public would call, the feedback that I received is that they were not only unfriendly but uneducated about healthcare facts. They were unable to get help, they were unable to have their questions answered, and they were unable to get navigation for the website. Many of the navigators and the population were frustrated and confused by this.
Hi, I'm Susan Shelbar from Oklahoma. I'm a navigator. I grew up knowing that my health and well-being was my responsibility, that my doctors worked for me, and in 2001 I received the diagnosis of rheumatoid arthritis, and that it was a pre-existing. My health care got personal and more complicated. I thought I was health literate.
Hi everybody, my name is Grace Burke. I am an assister in Oklahoma, and what do I know about health literacy? Well, what do I know about health literacy? I know that this was probably the hardest 6 months of my career and the most rewarding as well. I'm really in favor of the Affordable Care Act and marketplace insurance. I think it's a little complicated right now for a lot of people to understand. I think it took quite a while for even the assisters to come up to speed and really understand what it was going to take to help people figure out how to choose plans. In Oklahoma here, we had 66 plans to choose from, and all of them were completely different. And so explaining them to folks and trying to explain insurance and then fill out the application the right way to make sure that people...
Hi, I'm Jennifer Dillahay. I'm the medical advisor for health literacy and communication, as well as the medical director for immunizations at the Arkansas Department of Health. I'd like to take a minute to tell you about something that we've done to advance health literacy in Arkansas, and that's this report right here. This report is entitled Arkansas's Big Health Problems and How We Plan to Solve Them. It serves as the state health assessment and the state health improvement plan for a report that we produce to meet the requirements for public health accreditation in our state. And the thing that's special about this report, I feel, is that we have included a chapter on health literacy. We used data that was provided to us through RAND using a process that they used to predict the health literacy scores that would appear on the NOW had it been done in Arkansas. So we have county level data as well as data on the census level tract. And the nice thing about this report is that people can compare the health literacy map with our map for infant mortality, as well as our map for life expectancy in Arkansas. So it helps people to see that there is a correlation between low health literacy and poor health outcomes, such as short life expectancy or high infant mortality. So, thank you.
Hi, my name is Mercedes Blanco. I am the head of the Translation Services Group at the Center for Health Literacy. Today, I would like to share with you one of the biggest challenges that we face while translating health insurance applications for state health exchanges. Since the Affordable Care Act is a new law, there are new terms and concepts that help explain the law, its component, and how it works. This terminology is new even to the English-speaking American population. So you can imagine the complexity involved in translating these new terms and their meaning correctly in different languages for people who may have had no experience with our healthcare system and who did not know much, if any, about the Affordable Care Act. As a matter of fact, in one state, we had to translate the terms into 11 languages. So how did we overcome this challenge? Early on in the process, we came across a glossary on healthcare.gov that explains these new terms. We then created our own customized version of it with more detailed explanations for our translators in order to familiarize them with the new concepts. Once the translations were completed, we took some of them to the field to make sure that we were on the right track. In other words, we show a draft of our translations to consumers from the certain language groups. We pointed out these new terms and asked if the translation were clear and easy to understand. In short, the translation of documents related to the Affordable Care Act had an added level of complexity because a lot of the terms used were new to everyone. We were able to overcome this by adhering to a tight process where we educated our translators in the new terms using our own customized glossaries and validated our translations through field testing. If you are interested in learning more about translation, we will be glad to send you a copy of our translation manual. Just send me an email at mercedesblanco@maximus.com. Thank you.
Hi, I'm Eva Anderson. I am the lead designer at the Center for Health Literacy at Maximus. Today, I'd like to share with you one of the biggest challenges we faced while designing health insurance applications for state health exchanges. Because of the Affordable Care Act, states have been required to create long, complex application forms in multiple languages. Our standard practice for formatting simple documents, such as a 2- or 3-page letter in other languages, has been to have our translation vendor do the desktop publishing and input the translation right into the original design file. However, the level of a complexity in the ACA applications called for a very different process. For example, on one state's application form that was 36 pages, just one of the pages had over 200 formatting transitions, so that in just one row of a table, the person working with the file might format a checkbox followed by a tab, then Roman text, bold italic text, more Roman text, a cell divider style, an indent, a new checkbox, etc. That kind of work requires a very detail-oriented and experienced designer. And don't forget that in some languages, such as Farsi, Russian, and Spanish, text expands so that the translation takes up more room than the source document. The challenge we faced was that when the English source document was sent out for translation, not all of the vendors' desktop publishers had the equivalent levels of formatting experience. When the translated applications came back to us, we found that a number of the applications were not formatted consistently with the original English application form. So how did we overcome this challenge? We decided to reassign the formatting of the 11 language applications to our own more experienced graphic designers. Still, our 5 designers had differing skill levels. Almost none had familiarity with the languages they were working in. They needed a lot of support from me and the more experienced designers, and also from the translators. In the future, when we get another complex project involving many languages, we'll pull all the content from the source file and copy it into a Word document or spreadsheet with 2 columns. The left column will feature English text, and the translators can put their translations into the corresponding right column. The translators will be able to check their work more easily before the formatting is done. And from the start, our designers will be able to format the other language files consistently with the original design. This was a project with many moving parts, some of which we couldn't have anticipated. Now that we've had the experience, we expect that the next multi-language project will go much more smoothly. If you are interested in learning more about design and formatting in multiple languages, send me an email at evamanderson@maximus.com.